Hello and welcome to Sheila Lives Out Loud. My name is Sheila Moniga and I'm thrilled you're on this channel. Please click subscribe and hit notifications so you'll never miss an episode, and we upload every Monday. We continue with my COVID journey. It's a series on this channel following up on people who've experienced COVID-19, and it's only just part of the greater conversation that we've been having on this channel since March of this year. We've talked to lifestyle and wellness experts, we have talked to survivors of COVID-19, and we've also touched base with my favorite doctor, Dr. Simon Kigondu, the Secretary General of the Kenya Medical Association. Dr. Simon, you're joining me for this conversation, for this episode. Sasa, how are you doing?
We are fine. We are trying to avoid COVID, but as you know, for healthcare workers, it's a bit tricky, but we are trying. But otherwise, we are okay, and I can see you're okay.
Yes, I am. I'm trying my best. I tell you, anytime I sneeze, the first thing I reach out for is fragrance malashi, or I look for sugar to try and taste it. And it might seem like a joke, but where we are with this pandemic, Daktari, it's no longer a laughing matter. In the beginning of the year, we didn't understand what we were dealing with, but the weeks became months, and the months have pretty much almost become a year, and we have a lot more information now than we did then. But sadly, we also have more infections now and a higher death rate. It's sad, but it is the reality, and it is what you informed us to expect when we began. But the recent week has been especially difficult for medics. So let's start there.
Yes. Again, for a short summary, Kenya was declared to have its first COVID client on it's March 13th, I think, 2020. And all the measures were taken to try to actually limit COVID from entering the country. So with all the lockdowns and the school closures and all, that was what was meant. But that phase passed. And after that phase passed, then there was COVID in high risk areas, specifically in the main towns with the larger populations. And those towns that are at the border towns and where there's a lot of trade. And we tried to control that. You remember there were inter-county borders where you couldn't cross and things like that, but that failed. Now, when the economy was opened up, then now the COVID effectively became community spread, and it went all over the counties, and it was not helped by the political process we are undergoing of the Building Bridges initiative, which has meant that people go out for political rallies. It also has not helped that we have started campaigning for the 2022 presidential and other seats elections. And therefore, that leads to occasions where you have super spreader events. A super spreader event is whereby one meeting could effectively ensure that many people are actually infected with COVID. And that has shown. The danger with that on the side of medics is that at the end of the day, medics have double jeopardy. And the double jeopardy is as follows. One, they are likely to be the ones to see patients who are suffering from moderate to severe COVID, meaning that people have actually gotten the symptoms to the extent that they have to come to hospital, and who they meet in the hospital are the medics. So the medics have a higher likelihood of contracting. Secondly, even those who are asymptomatic, let's say, have to come to hospital for one reason or the other. A classic example is in my field of obstetrics and gynecology. Mothers may be asymptomatic for COVID, but spreading because COVID may have colonized the nose and the throat. And as you're delivering, you know that maternity, you need to breathe in and out a lot. And as you can see, the medics who are actually taking care of these mothers may get infected with COVID, even if the mother may not show symptoms. And therefore, over and above that, being in contact with a health facility where you can contract COVID, medics also live within the community, which now has an increased number of people with both symptomatic and asymptomatic COVID. And therefore, you can get it, I can get it. Any which way you go to the community, you get COVID. You go to work, you get COVID. So, and hence, it is upon them, and the medics have therefore asked the general population to actually take measures to prevent themselves from getting COVID so that they avoid transmitting it to the medics. And therefore, the usual measures of COVID, it is important for people to actually continue with those measures. And of course, to the politicians, we are trying to tell them to avoid the political rallies, and I hope they heed to that message.
One thing we do know about a politician is they live for a crowd. I know a lot of people will say it's an artist's job, wasani, you need a crowd, but I think there's certain people who need crowds even more, and those are politicians. And there are a lot of people online who've been saying, ultimately, when a politician holds a rally, you as a grown-up, a sane human being, you should know better and you should think twice before you go and expose yourself and place yourself at risk, which is a very valid argument. But in the same breath, we've got the government that's already told us NHIF cannot be able to cover us. We've got insurance companies that are saying, well, it's too bad. And in the same breath, the politicians are still doing their due in certain small, slight, they're just taking things and still making everything bend to their will. What would you say about that?
Yeah. So in life, there are levels of responsibility. You've had the common complaint that why is a chicken thief jailed for years, that those who have stolen millions as the politicians do not face the same justice as the chicken. Yet the impact of the theft of the billions is much higher than to a population. Therefore, there are actually levels of responsibility. Therefore, the common man will not come to the stadium when the politician does not call for a meeting. And therefore, the common man will not get infected when a politician doesn't call for a meeting. The common man will come to the stadium to listen to the politicians because they have the perception that what the politician is coming to say will actually help them in the problems they are actually facing in their daily life. No food, no clothing, no shelter, no healthcare, no education. And therefore, they go not because they want to cheer the politician, but they think that what the politician will say will improve their lives. And indeed, the lawmakers have a responsibility of actually doing exactly that. Their role in the lawmaking process is to ensure that we have policies that improve the health of the people. One of the issues that has come up in COVID is the Ministry of Health has actually done a very good job of issuing policies and guidelines that would help limit this particular pandemic. So when the politician does not follow it, or when the people he has called to a meeting do not follow it, he holds the highest level of responsibility for that. On that, it's the same politicians who, for instance, the medics have asked that they do certain things to protect the medics, plus Mwananchi, which the politicians have not done. And some of them include, as you have rightly said, recently there were pronunciation by the National Hospital Insurance Fund that they can't cover for COVID. Personally, I think that is criminal. An insurance should not say what they are covering for. You are actually taking out a medical insurance to be covered for sickness. So the insurance is for sickness, not for COVID, not for malaria. You as an individual are taking out an insurance because you may get sick and you don't know what will make you sick. Your job is, once you're sick, the insurance take care of your expenses so that that do not take you into poverty, because a disease can easily take, even the richest man, it can easily take that. But if you have an insurance, which in principle is that people have pooled a lot of resources from all over, and only a very small percentage of those people will actually get sick, even if that sickness will cost a lot of money. It has been pooled for many years. Therefore, it should be able, if well managed and not stolen, to actually cover the whole country for all the diseases that they have. And we have examples of countries where insurances actually cover people for what it just means that the insurance have been directed to the right, the correct use, and the taxes that the people are taking, however high they may be, are actually being used correctly. So it is not correct. And secondly, there have been issues with, for instance, the medics working in the public health facilities being forced by county governments to be insured by less than ideal insurance companies. And the way they are looking at it is that the private insurer has actually made a deal with the county public service boards, or the people who are actually in charge of HR, given them something small to purport to cover. And when it comes to now paying for the illness, then they don't, because ideally public insurers they also want to make a profit. So we do not premise our insurance cover on a profit-making person. We should actually premise it on NHIF, for instance, which is sort of directed towards social insurance, social protection of sorts. And those are some of the issues that are coming up.
Okay. Now that you've mentioned county governments, I can't help but think about some counties where, the newscasters and the news, the different stations are going to show us on the news about preparedness in different counties. And preparedness in this instance is literally beds, very rickety structures with mattresses. There was this whole period where everyone was supposed to get ready, where counties were supposed to purchase the necessary supplies. But for so many, it became about trying to achieve a certain bed count. Now, a bed count is neither here nor there, because how is a patient going to be treated on a bed and a mattress? Where are the beddings? Where's the patient's clothes? Where are the PPEs for the doctors? In being COVID ready, it goes without saying, many of these counties, of all of our counties, have dropped the ball. Nobody used that time to get ready. Where did the resources go? That's a question for another forum and another place, but it's obvious that that ball was dropped. So here we are with ridiculous numbers. I tell you, over the past 2 weeks, I've been talking to Kenyans who've gone through that journey, and it's rough, Daktari. It's rough. We're hearing about people who at night you're wondering if your oxygen is going to be taken by someone else. Yeah. That is where we are today. So where do we go to next? What do you see happening next? Because right from March, I have spoken with you and walked with you, and now I'm afraid for us, genuinely afraid. What happens next?
Yeah. So, well, the issue we are having here is a failure of acceptance by the county government that they cannot, how do I put it, fully fund or operationalize health services, which is a story we have been saying from the time they unconstitutionally devolved health. Of particular note is that the human resources for health, the people who work in health, we have continuously said it is not possible for any individual county to actually fully support the human resources for health. So in the COVID era, we'll give a good example. We have intensive care units. Intensive care units need anesthesiologists as the head of the intensive care unit. The counties have been unable to increase or even employ anesthesiologists. Therefore, even if you say you have an ICU without an anesthesiologist, it is not functional, meaning that it's a building where it's like a ward, you see. And secondly, the counties have also wanted to look like in their report, they say, oh, we have 300 beds, we have an ICU, but now the measure of the functionality is what Mwananchi is actually unable to do. So if your governor comes and tells you, I have an ICU, and these are the beds, and they launch it, then it looks, you see, it's very easy to see and that time beds have been borrowed.
Exactly. Bed and a mattress, yes.
Even the beds have been borrowed from a nearby private facility so as to launch, to give the perception of having an ICU. We have a very sad case of one of the counties where one of the health workers actually got COVID and actually got complications of COVID and needed an ICU. 2 months earlier, the governor had launched, in quotes, an ICU, but when the service needed to be given, that health worker in that hospital needed to be transferred to a facility now like Kenyatta University and died en route to the hospital. So that is the level of, that's where we should actually now ask our governance. So when you tell us in ICU, is it functional? And the SI unit of that is to ask your doctor, if he falls sick or she, would the facility they are claiming that has the facilities actually, would you sleep there yourself?
They stay there, exactly.
Yeah. Would you take that service yourself? And if they say no, there's a problem. And health workers have actually put down their demands on what is needed to improve these facilities. And one of the major issues I think you've heard over and over again is that they've asked for a centralized way of managing human resources for health, a constitutional service commission, which they're still fighting for, hoping that we will get it one of these 5 days.
You know, it goes without saying, what is a nation without the people? You cannot govern no people. You need people. And I think it's this year is a call to action for people, by people, with people. It's all bringing it back down to the basic block of what this existence really is. It's about people and how you take care of people. And speaking of people, the past week for medics has been especially rough. I've been reading about many of your colleagues who have passed on, and some saying, you know, if you don't feel safe in a facility as a medic, do not show up to work, because clearly, like you said, you're the first line of defense. How are you going to go and put yourself in harm's way? How does that solve the problem for the nation? Where are we with that front, and how are you as the Kenya Medical Association addressing this very critical problem?
Yeah, so thank you very much for that comment. The Kenya Medical Association this morning actually sent out a communique of condolences to the families of all those doctors and other health workers who have actually lost their life to COVID-19. And quickly going through the list, there's Dr. Doreen Lugaliki, an obstetrician gynecologist, Dr. Ndambuki Boloi, a pulmonologist, Dr. Daniel Alushula, an orthopedic surgeon, Dr. Robert Aisi, a pediatrician, Dr. Hudson Inyangala, a public health expert, Dr. Vladimir Shukin, a bariatric surgeon, Dr. Ashraf Emara, who is a plastic surgeon, Dr. Hudson Alumera, a dental surgeon, and Dr. Jacqueline Njoroge, who was a physician at Thika Level 5, and there is a pharmacist in Meru. So those are the professions that are actually, those are the doctors who have actually lost their lives. Now, on a broader picture, you see those are highly specialized doctors.
Yes.
And you want to that means that COVID can easily eliminate many years of training and experience in a day. And this should be a call to action that not only will it take a long time to actually replace that quality of healthcare, but it is important to ensure that there is protection of these very rare resources. Already we are saying they are rare, and now you have them exposed. So, and this happened in Italy, where after some time, they even now, anyone who is a health physician, who even if they have COVID, feels well enough to continue working, they continue. Why? Because it had actually taken out a lot of healthcare workers, and this is where we do not want to go. So we urge the government to actually put in place some of the measures that would ensure the well-being of healthcare workers is protected. And we also urge you people as the general public to avoid getting COVID so that you don't bring it to us so that we get eliminated. Unfortunately, also in health, a lot of the senior consultants have been classified as the at-risk group. And in medicine is highly hierarchical, meaning that the older you are, the more likely you are to have some form of experience. And this seems to be a big issue because they are also the at-risk group. They constitute the lecturers, the people who give guidance on how this health should be. So we do not want to lose a population that is highly skilled, highly experienced, because that it is mwananchi who will lose that. But it also seems to be causing mortality in the younger ones who also may have comorbid. We are not immune from comorbidities, even as health workers. We also see doctors once in a while. So that, as the medical fraternity, we are actually are very saddened at this. But unfortunately, we had warned all this. And when we look at the way they are being treated in terms of having no medical cover, therefore, we have done a lot of harambes for even some of those colleagues that I have listed there. We are actually fundraising for a task that should actually be covered by the government. Unfortunately, assuming that yes, all of us will die, but if you die on the line of duty, like the soldiers, you sort of need some form of cover for your family. Like if by bad luck a doctor is to die, then there needs to be some form of cover for the wife, the children, and the family, that because doctors also live in a community where they are the breadwinners, they take care of themselves, their families, and their extended families. So and that is important, because when you're going to see a patient, then you think, I might get COVID, I might die, I might leave my wife and children, then there may be hesitancy in actually providing service to Mwananchi. And therefore, some of the actions that are supposed to be done actually protect Mwananchi, and they increase healthcare service delivery to them by ensuring that people are comfortable. When the government does not supply personal protective equipment, it has been described by one of us as suicide, to actually go see patients when you know that you're likely to get a disease that might kill you, you see. So personal protective equipment is also helpful to Mwananchi because it helps service delivery continue. And finally, this distribution, where you need more health workers employed so that they are able to work in shifts, so that, for instance, should people get COVID, go out in isolation, service delivery continues. Then you're not forced to actually continue working when you're sick. So that is what the deaths of these health workers has actually revealed. So we are saying health worker safety is actually safety to the patients. So that is the message for this death. And we hope that the general population like you and your very popular programs would reach out to top government echelons to actually do for health care workers what they want, so that Mwananchi can get treated.
That's true. I mean, and it's not asking for much. If you can just stand in the gap for health workers. Let's begin there with making sure that the people in the front line have some kind of cover. Let's start there. Let's take care of the people who are taking care of us as we navigate the waters in a very interesting holiday season in the making. But as we wind up, the holidays are here, people have been traveling, and I think the traveling is still going to continue. Your final words of advice, not that you're going away and we'll never talk again, but echo those words of wisdom that you have been sharing right from the get-go.
So I think every individual effort, every effort by the workplace, every effort by the employer towards prevention and mitigation of the spread and treatment of COVID-19 counts. And therefore, we keep repeating things that look obvious. But the mask is one of the most important deterrents. One of the reasons why we are even able to go about a bit of our business is the mask. But now mask, we have to qualify and say that one, you don't wear it on your chin, you actually cover your nose and mouth with it. And if everyone sort of wears their masks, they can actually go about some good business. They say that transmission of the virus can occur through the hands, touching the nose and the mouth. Therefore, washing hands with soap and water has been shown to be effective. And therefore, even in those places where they need to put in place such measures, put taps and running water. Where they can't, then you can carry around sanitizer, which is alcohol-based. At least 60% of the fluid should be alcohol, and that has been shown to have some effect against coronavirus. So once your hands and your mouth and nose are covered, then there comes the higher levels where we say keep some distance. You may go to a place where maybe you need to remove the mask, then keep at least a meter and a half away, and that's called social distancing. The studies may have shown that the jump of the virus may not be that fast. So yes, there are those occasions where you may need to keep distance. And then those people who now start, if you get some symptoms, like dry cough, running nose, difficulty in breathing, then you should be seeing the physician, some form of doctor, so just to reassure you that is not COVID. To the government, we urge them to, one, increase access to testing. And this is several things. One, reduce the price. You see, if someone is told to go and test at 8,000 shillings, they'll never go. And two, increase the number of places where these can be accessed. I think in the long run, they should just take it down to the community. And three, increase the number of test kits and viral transport medium for that. And finally, we urge the government to take care of its health workers by giving them, as you correctly put it, good packages for protection, comprehensive medical cover, a last package, because you never know, you just never know. And eventually for the management of human resources, so that you're able in future to get good management of this, so that we have adequate staff, skilled, who have good career progression and job satisfaction, a health service commission.
Mm-hmm. Thank you. Thank you so much, Dr. Simon. I think in our next briefing, when we speak to each other in hopefully a few weeks from today, we can speak a little bit more about this vaccine. I think it's still too soon to celebrate and to start discussing what it means. Let's wait for more concrete information over the next few weeks. And then when we touch base again, then we can chat about that and see where we're at as a country. As always, thank you for making the time. I wish you safety and sanity. Thank you for speaking with me. And thank you to you for watching this episode. Remember, COVID is real. Just follow the protocols. It's no longer a question of if, it's a question of when. And you want to make sure that when you are not feeling well and you're diagnosed positive, the healthcare facility you visit is going to be able to cope. It's going to be able to provide you with a bed should you need one, and any other services that you require. Stay safe, stay sane. Drop a comment in the comment section below, and remember to subscribe and share this video and live out loud. And, okay, I promise a final and, catch up with me next week for another episode. Until then, live out loud in all that you do. Bye for now. Bye, doctor.